But I would argue that, in general, it is kind of incumbent upon even your most basic workflows to adopt digital technologies.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab.app Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab.app Practice Solutions. And interestingly enough, I'm doing a little bit of market research here around virtual healthcare delivery, remote therapeutic monitoring, telehealth, the like. And what is interesting is that of the respondents, and I want to say there were a couple hundred in this survey, 92% say that they have recently received training, instruction, or enrolled in continuing education courses related to virtual service delivery models. And on top of that, of the practice owners surveyed, 78.8% said that their practice currently delivers or plans to deliver telehealth or virtual services such as remote therapeutic monitoring within the next 12 months. Now, that is interesting in and of itself because as a clinician, I like kind of seeing where things are going in the field of just direct service delivery and provision. It's also interesting if you happen to either run a clinic or an organization, you want to begin implementing, or you're thinking about implementing some of these services. What also came to light during some of these surveys is that the majority of clinic owners and department heads and the like, while they have responded that they see the value in remote patient monitoring, for example, and they have taken courses on it and they plan to deliver it, very few of them, less than 50%, have actually begun to evaluate RTM tools in their clinic, which to me would indicate, and this is borne out true in my research and my consulting with healthcare organizations and healthcare organizations that are or healthcare technology companies that are involved in remote therapeutic monitoring, is that there's just a lot of hesitancy among the decision makers in healthcare settings, whether it be ambiguity around how they're going to take those tools and implement them or integrate them in their workflows, or just questions about billing and ROI. So it's interesting to see. If you want to learn more about that, head on over to strategy.rehab.practicesolutions.com. Book a call with me. I'd love to have a conversation with you. Anyways, this week, speaking of technology, virtual service delivery, and the like, I am having a conversation, I'm sharing a conversation with Devin Mobley from Calvient Healthcare Solutions. They're a healthcare technology consulting firm. Essentially, they help build software and workflows for organizations looking to implement technology into the administrative function of delivering care and also the patient experience, patient engagement side of things. So one thing that is interesting to note is that, and Devin makes this point early on in the conversation, is that virtually every other industry or business has a lot of the administrative functions automated or virtually synced. For example, online scheduling, appointment reminders, text messages, push notifications if you've got an app or something like that. Healthcare is one of the few laggards in that area where we haven't done a good job of implementing that. Now, part of that might be, and we talked a little bit about it in the episode, some of that might be related to integration and HIPAA security and compliance and all of that. But the other piece is that a lot of healthcare organizations have already in place certain clunky, siloed pieces of software. So it's hard to make them all work together. And then the fact that clinicians and organizations are just resistant to change, right? So this is an interesting conversation. We don't talk so much about service delivery, virtual service delivery here. We really talk about the kind of a high level, the philosophical approach to implementing technology within the business of healthcare, both on the admin side, the patient engagement side, decreasing barriers to adoption, and reducing the friction for not only clinicians but also patients to adopt and to use these tools, these portals, these pieces of technology and software that can make life a lot easier, can improve clinical outcomes, increase continuity of care, improve communication among providers and patients. So how do we do that, or how do we think about building that into the process of delivering care? So hopefully you find this conversation insightful and interesting and entertaining. Hopefully you walk away with really just some ideas about if you're planning on integrating some technology in your own practice or your own clinic, or if you're on the supplier side and you have a device or you have a tool, thinking about how your tool, how your device fits within the workflows of a regular clinic or a normally operating clinic. So without further ado, here's Devin Mobley from Calvian Health talking about integrating technology into the process of healthcare. Well, hey, Devin, welcome to the show. How are you?
I'm doing well. Thank you so much for having me.
Yeah, thanks for being here. I'm excited about talking really about technology and its impact in care and patient experience and all of that. But before we dive into that, why don't you tell us a little bit about yourself, your experience, and what led you to what you're doing now?
Yeah. My name is Devin Mobley. I am the head of business development for a healthcare tech company called Calviant, sometimes Calviant Healthcare Solutions, depending on who we're talking to. And our main reason for existence is that the founders, all of us who founded the company, there's four of us, we are all software developers that started working together in a specialty hospital environment that was at the time pretty forward thinking when it came to, I think, creating new interfaces and ways to integrate technology into workflows in a specialty hospital setting. And so fast forward, and we all, after leaving that organization, came back together and wanted to continue doing work in healthcare. We're all really passionate about healthcare. We all, to some degree, consider ourselves, though we're not clinicians, consider ourselves healthcare professionals, kind of alongside software developer, engineer, right? And so because the importance of healthcare and the many needs that the industry has, we wanted to see what we can contribute. So we have we work a lot with Cerner clients because that's where our expertise is. But we work with pretty much any EHR and any type of healthcare workflow. So
awesome. And one of the things we were talking about last time we met was about the whole idea of technology and the implementation of digital channels and what that does to things like patient experience, patient engagement, or even compliance with the recommendation of their clinicians. So given that as kind of like the backdrop, what are some maybe simple ways that clinics or organizations maybe are going about their usual workflows, but they're inadvertently hindering retention or great patient experiences with the way their technology is being implemented or used in their workflows?
Yeah, it's a very important question. I think kind of at the outset, it's also very important to, I guess, level set that. I remember one speaker put it really well that the healthcare system, a hospital, a clinic, anything, they're complex systems, and so it's really, really hard to like point the all of the blame or even close to the majority of the blame to any one factor. It's super multifactorial, and that's just how healthcare is. Everything is complex. It's just like anything in bioscience, biology. It just is kind of, it seems like it's that way by nature. One of the factors that I would point to is that digital technology in healthcare was adopted somewhat forcefully in a lot of ways. EHRs came around, and then not too long after that, it was required that, I don't know how it works outside of, say, like a hospital-based clinic, but there's a lot of regulation as to meaningful use and the sort of the digital requirements of offices. There are plenty of offices even today that tend to circumvent that one way or the other, and that may work for them in their specific use case. But I would argue that, in general, it is kind of incumbent upon even your most basic workflows to adopt digital technologies. And that's kind of really our hypothesis behind patient engagement. The first main product we do both at Calvin, we both do both products and services, and we like that because we get to cover a wide variety of use cases. And we kind of started in the patient experience and patient engagement realm because one, we knew kind of some workflows to solve there, and two, it can really be a high and easy ROI sort of payoff for a clinic. Like so, for instance, we offer appointment reminders software that is integrated a little bit better than our competitors and has better digital interfaces, which is something that I'm sure we'll talk about as well.
Yeah.
And being able to reduce no-show and have more efficiencies in your scheduling slots is just an easy win for clinics to be able to unlock some savings there. So as far as the whole inadvertently hindering retention or great patient experiences and that sort of thing, I think that the main thing that I'd point to is that what we would do if your clinic or your operations were in a different business is we would just automate it. We would just put that within the technology and we would make it really easy for you to use. Pretty much any retail shop these days, for instance, has scheduling software, reminder software, everything that's super out of the box. It's really affordable. We're talking like tens or $20s a month for each piece. It's not as integrated, but the difference, the key difference here is that you're required to use an EHR, not like a CRM or something like that.
Yeah.
And ultimately, EHRs don't have good interfaces from a data perspective and just from a workflow perspective. So a lot of times, even though you're required to use them in a lot of cases, it ultimately becomes more of a burden. And I would say that that's happened kind of, if you were to kind of take a very macro view, that's kind of happened all across healthcare, really across the board. What has become a very in-person experience in healthcare has now become very data entry and cumbersome, to be completely honest.
Yeah. Now, what might be the bigger driving factor behind that? Is that because a lot of these EHR companies have their own proprietary tools that they're wanting you to use, or is there like an API sharing? I'm sure there's cybersecurity and data safety and all that plays into it, HIPAA and all that. But I guess what are the pinch points that are keeping it so disjointed?
Yeah, this is a topic that we fire ourselves up in the office a lot about. I would say that you're right, that the moat to create good software in healthcare is just too big. There have been companies and open source initiatives to try and recreate the EHR. There are even initiatives, and some of those initiatives are regulated. For instance, like the regulation of implementing, I believe it's through meaningful use, the third version. I could be totally wrong on that, but this idea of creating a standardized way of system sharing data, those things exist. Ways to interject clinical decision support, those sorts of tools, those exist, those standards exist, even some really great implementations of those. But ultimately, the crux of the issue is that the big EHR vendors grabbed a hold of the market early, and then they were able to dig their moat and create it very, very wide. Yeah. So it's very, very difficult to jump that and create good software. To some degree, I think that smaller clinics and smaller clinic systems that aren't connected to inpatient services tend to have a little bit easier route to go because they can kind of treat some of their operations as small businesses and use non-healthcare specific tooling. The risk there, of course, is the HIPAA concerns and things like that. You have to exactly, and you have to know. I think it's just a scare tactic, really, or not a scare tactic, but more of just like a fear. A lot of people won't go down that route because they don't know the questions to ask their vendors in order to secure like the proper BAAs and those types of things that, like, for instance, us in the company secure right at the get-go whenever we work with people. So yeah, I think I would point to the unfortunately the gatekeeping and the moat that the large EHR vendor companies have created, and that goes part and parcel with consolidation, right? So in the past 10 or 12 years, we've seen a huge consolidation movement into larger systems, specifically so that there's cost sharing in adopting digital products.
Yeah.
So it's this double-edged sword that's really, really interesting.
Yeah. No, I think your point about not knowing the questions to ask, I think even the private healthcare, independent healthcare clinics out there, like we didn't go to school for this. We don't have any idea about technology. We turn the computer on, we log into our EHR and we start documenting. So you start talking about, security protocols and this, that, and the other, and people's eyes just kind of glaze over. So it's
That's
easier
right.
to spend a couple extra $100 and get something that on paper is, integrates with your EHR and is safe, right?
That's right. That's right. And the internal owner of that is also really important. I can't tell you how many small clinics we've worked with that, it's some office manager or case manager that ends up kind of like taking over
Yeah.
as what essentially amounts to a bit of an IT role, right? And so that's how small businesses work. And I think that there's a bit of that's okay. You know what I mean? If you're the owner of a clinic or something, you really have to just kind of like find the right solution that works for you. Primarily focusing on just good people who are willing to take ownership of those things. But when it gets really risky like that, it does create a lot of fear and anxiety, unfortunately. And I don't think there's a lot of good resourcing out there. And what resources are out there are really, really gate kept for your larger healthcare systems and people with funds to be able to
Yeah.
access them at the ready, it seems.
Yeah. Well, so we've talked about some of the challenges,
Yeah.
but if you do it right, like how can technology, digital patient pathways, all of that, how can that improve retention, compliance, et cetera, for the patients in the clinic?
Yeah. I think so. I think that there's a bit of like a macro view you can look at
Yeah.
this, and there's a bit of a micro view as well. I'll just start with the micro view that I think um, to the extent that you as a clinic can put on a sort of small business hat on and say, what are the things as I scale that what am I feeling right now? So I'm an entrepreneur. I've been in the creation of several businesses. And one of the things that you hear a lot in sort of the startup world, at least, is create processes that are going to inherently not scale. And only when they hurt, then find a way to scale them. That's in the context of software. So that's like infinitely scalable. It's a completely different beast. But for small business owners, I think there's just a bit of a principle at work there, right? That how can we make consistent experiences for our patients? And as we do that, find processes that allow us to ensure that even with things like turnover or staffing issues or changes in the way that you're going about, say like a billing process or something. It's really kind of all about there's a concept of processes. And from a software perspective, as a software developer, we always tell our clients, especially our custom software development clients, no uh, no software solution is going to survive the process that it's built on. So if the process is bad, then it's just inherently going to break, and it's not going to fix the problems that you intend to do. So all that to say, I think that just automation is an interesting kind of buzzword, but I think what it means for a small business owner is how can I find the things that are really hurting us and really keeping us from creating a consistent experience for my patients, and then finding a way to automate that. And there's so many great ways to do that without being a software developer. If you're a super small clinic and you're using sort of cloud-based kind of consumer level or small business level tools, then like what would it look like for you to learn a little bit of like Zapier or like have like some things that help data flow back and forth. That's
Yeah.
not going to get you all the way there, but the tooling is there, and it is a way to start learning how to do this process creation piece of it.
Yeah.
Um, sort of macro view of this is really just that it's multifactorial, and there's things that are evolving, but there's important hypotheses that I don't see tech companies kind of approaching or solving, which is another great, every time someone is like creates a new business or nonprofit or something like that, it's because everyone who's the incumbent and is doing it wrong somehow.
Yeah.
We kind of feel that way with healthcare tech right now, unfortunately. But I think there's something there. I think one of the things that you look at is that um, the healthcare in general is suffering from very, very acute, very real on the ground issues. And unfortunately, tech tries to go for the high value, high innovation type solutions. And they also do so in such a way that maybe doesn't really solve the problem in a way that is empathetic to providers, patients, and those types of things. So I think that two major things that I would point to is one, I had a provider, a physician at a fairly large hospital system tell me recently that he thinks the biggest risk in healthcare right now is patient trust. That
Yeah.
patients are going to continue to erode their trust, and it's going to be a very, very slow burn, boiling frog effect. But we're going to look back in 25, 30 years, maybe even sooner, and if nothing is done and solutions aren't made, and really look at kind of the last 10 years or so up till now being a time where we just started taking an even steeper nosedive when it comes to creating trust within our patients. And then the other thing I would say is just that, like, how can we free up providers to just do what providers do best? You know what I mean? I think I know kind of on our little agenda we might talk about AI, but I think one of the things that's really exciting about the future is that, as a patient, I kind of want to interface with my doctor more. I want to don't not feel like my questions are being rushed.
Yeah.
And I think that studies have shown that patient trust is actually really key. That the clinical outcomes are better, that the financial outcomes are better, and all that. And we can dig into that, but that's kind of the things that I would point to, both from a macro and micro perspective.
Yeah, I'm glad you brought up trust. We talk about it a lot, both in the clinic and in our consulting work. Like, trust is kind of the linchpin for healthcare, because if a patient doesn't trust the doctor, doesn't matter if the doctor is giving them like the the information they need to solve their problem, or cure their disease, or manage their symptoms. They're not going to listen to them because they don't trust them.
That's right. That's right.
um,
And they're not going to do this, like actually go forward with the treatment plan. And
exactly. Yeah.
one thing I think about a lot too, my wife's a nurse and she talks about this a lot, is this idea of patient self-advocacy. I think that that's becoming increasingly important, and previous generations tended to just trust doctors and not self-advocate.
Exactly.
And I think that there's a really, really great outcome when it comes to patient provider working together and patients being willing and able and have the time frame in a visit situation to actually self-advocate. And that I think that will only lead to better treatment plans. It has to.
Yeah. Well, and so kind of on this topic then, tools that we might implement in a clinical workflow that can help increase trust with the patient. Are we talking like communication tools or device or software or whatever, or maybe it's educational component? Like, how do you see that kind of helping build the trust between the clinic or the organization or the provider and the patient?
Yeah, that's right. I think that if I were to kind of project forward to reverse engineer an answer to this question, what I would point to is all the things, all of the futuristic type things that are going to be able to free you up as a provider to interface with your patient. However, if I'm looking more at the near term, I'm going to be looking at things like how patients do communicate back with clinics.
Yeah.
Right now, we kind of are in this interesting thing where patient portals are almost required, right? And almost every EHR, and they're all terrible, absolutely horrendous. And one of our sort of principles with digital product creation is we want to eliminate logins where we can. So the reason that we kind of chose Cerner is because we know how to integrate while using the existing Cerner login. And that's a small but really powerful thing, because now you're not having to switch over to a different tab or whatever and go to a completely different system. It should be integrated better, and that's the type of interface that we should go for from a digital product perspective. The other thing that I would point to kind of near term is kind of going back to the patient portal thing. Whenever you have a small question, I think it's very common for people, especially if they're anxious about something, let's say like a patient with like that was just diagnosed with something pretty big, like an oncology patient, or say like a pregnancy patient, or a patient who's expecting. Those situations create anxiety even in healthy patients, and otherwise healthy patients, I should say.
Yeah.
And then they need small questions asked that they're not that it feels like the patient is almost in the situation where they have to jot everything down and make sure that they get everything asked. And
Absolutely.
like
Yeah.
I do that like with my mechanic, and like my healthcare providers as well. It's like I want to make sure that I get my questions answered, but there needs to be asynchronous access to this information. And that asynchronous access is extremely critical, I think, to the patient trust in the immediate term. Now, right now, you have that, but it's behind a patient portal. It's not integrated across providers. And this is where I know you and I have talked about this from the Calvin's perspective. We have a secure chat tool that the hypothesis is built on exactly that. If we can increase the amount of providers that are, say, like on a communication tool and increase the ability for async communications, then frankly, it kind of has downstream effects on everything else. Your patients aren't having to come in as often. They're not taking up slots for, say, like if we could kind of use this terminology like a lower value or lower impact type visit.
Yeah.
Every
Yeah.
your schedule slots are all going to be high impact and high value, and focused on. And so you kind of like look at the downstream effect of how you can use the right tool for the right job, asynchronous communication, telehealth appointments, rehab, in office visits, outpatient procedures. All those kind of need to be an arsenal for a given, depending on the specialty, obviously, and used in the most efficient ways, I think. Excuse me. And I think having that asynchronous communication is really powerful for patients, and I think something that patients are kind of expecting without realizing that they're expecting it. And I just don't think patients are using patient portals, like frankly. I
Yeah.
think that they're looking for maybe lab results, but outside of that, I don't think that they're using it.
Yeah. Or they sent a message to the doctor or something like that, and the doctor said, "Oh, we'll upload it in the patient portal," and that's the only that's the only time they're
Yeah.
logging in. Would you see it being something that's more maybe individual specific versus general? Like you mentioned having asynchronous access to information. In the back of my mind, I'm thinking like, oh man, like what if a clinic or a clinician or an organization has like a library bank of maybe informational videos or something like that pregnancy patient that you mentioned, like somebody they just found out they have this condition, they don't know what to expect, you see them, and then you can send like maybe an automated workflow or an automated sequence, if you would, of like, okay, these are the main questions you might be having ahead of your appointment. Make sure XYZ is in place, or maybe you want to think about this or think about that. Like, do you see that being part of it?
Yes, absolutely. I think all this comes down to using the interfaces that patients are used to. This is why SMS is so powerful, frankly.
Uh-huh.
Like, so in the future of Calvient, like we would love for everyone to be using secure chat and for that to be kind of a huge product. And we kind of take a real curiosity and scientific approach. Like, we know that the market won't use our product unless it's useful, right? So we're kind of committed to building something that we think is really cool, but also is super useful to our users. But SMS is the thing that people use, right? That's the reason that even like consumer goods have gotten to where like marketing is happening more and more over SMS. So I think what we see ourselves building out of, and I think that this is just our hypothesis that I would share with anyone over the market, is that you already have this interface that patients are already wanting to use, that they use it every day, and they're willing to use it with like someone like a healthcare provider. And then all we have to do as engineers is sort of alleviate the technical challenges of it being secure, of it being integrated. Like for instance, with our secure chat, we can integrate multiple teams to be able to chat with the patient in kind of one interface. With SMS coming from a single number, you can't do that. You can't like handle replies in
Exactly.
that way, right? However, but I don't think ultimately, I think ultimately we're still going in the right direction, still going with SMS. And the reason being, one thing I saw the other day was a study that took a hospital that already had an existing practice of calling all their case managers would call every patient in order to reduce readmissions, which is a process that they adopted. I think it's a great idea. And what they found is if they replaced those phone calls just with an SMS checkup, that not only was it at parity with the phone calls, it actually reduced the readmissions by a large percentage, 30 or 40%, if I remember correctly. And the reason is because patients were most likely to respond and check in, and because you weren't being disruptive, that it was something that, again, you're used to receiving text message notifications, et cetera. You could say, okay, nothing feels wrong right now. But if something does feel wrong, then you have a channel that you can immediately respond and notify someone like a stakeholder of your healthcare that something could be going on. So I think that, it's really about leveraging in the near term. It's about leveraging the things that make the most sense moving forward, that are meeting our patients where they're at, that are using industry standards that are elsewhere, and really just leaning into those. The more we named our platform channels, because the more you can open up the communication channel between referring providers to provider, and everything, all that to the patient, then everything from financial to clinical outcomes all go up as far as we can tell from the data.
Yeah. No, that's awesome that you mentioned the SMS idea, because the reality is, like, so at home, we've got 5 kids. It's crazy. We do something with the doctor. They're going to call us and follow up. I can't tell you how many times, like, just for a phone call to work out in a busy family schedule, like all the stars that have to align for, me to be available, for my wife to be available while the clinician is available to make the phone call. Like,
Yep.
how much friction are you removing by it just being a simple asynchronous interaction that doesn't, like you said, is the value in the synchronous interaction, or is the value in the patient getting access to the information and being able to kind of raise the alarm up the flagpole if they need to notify somebody, or give people a thumbs up if they're good? And the value, in my opinion, would be like, it's just that it's having the access, right? It's opening up that channel. It's the ability for the patient to click the button that says, yes, I'm okay, or no, I'm not. Who do I need to talk to?
That's right. That's exactly right. And if they're already interfacing with that, I mean, a tech CEO I follow said this once, is like, the reduction of friction is one of the most underestimated forces in the world. You reduce that friction, then you can do things like you were alluding to earlier. You can send your patient satisfaction surveys. You can send education. We have a tool where the reminder system will also send the online paperwork, so that ideally you eliminate everything that's in office, so that you're purely focusing on what the right tool for the right job, the in-person synchronous, like what is valuable for that. And the more that you do that for the patient in the clinic and also free up the provider, it's a win-win, I think.
Yeah. Well, and so we've kind of dabbled into that, like, how can technology and tools improve care from a patient perspective? I think the big one that we're kind of laying out here is that if you use some of these tools, you can take, like you said, some of those in-office workflows out of the office, so that when the patient comes in, they're right there. They're getting what is valuable to them, which is the interaction and the relationship building, really, with their clinician.
Right.
And you mentioned this earlier, so we're going to dabble into this topic now. So the big topic these days is AI, ChatGPT, and artificial intelligence and algorithmic learning. And I guess just kind of back up big picture, like, what do you see and how do you see that being used in healthcare, like big level, high level picture? And then we can kind of dive into the things that people are worried about, like, will it replace providers? How can it make us more effective as clinicians, that kind of stuff. But let's start high level. How can AI kind of improve things across the healthcare industry? And then we'll kind of dive in from there.
Right. Yeah. Yeah. It's a fascinating topic. It was interesting just that, like, in the past 10 years or so, there was kind of these 3 edge technologies: AI, blockchain, and like XR, AR, VR. And it seems like AI has certainly already won. We had this hype train for blockchain and Web3 for a long time. And frankly, as a software developer, I was never really on it, to be completely honest. I knew that the tech wasn't there, the tech infrastructure. What ChatGPT has done, and just OpenAI as a initiative, has really unlocked just kind of a democratization and also some infrastructure that is needed for the industry. And so, even long before that, there were some great AI companies that were focused in areas of clear need. So that focus was in things like diagnostic imaging, in
Yeah.
areas like billing, these sort of algorithms that like billing offices kind of go through in order to ensure that they're billing correctly and that they reduce their denials back. That is kind of like perfect use case for like a neural network, in the way that it works. And what ChatGPT has done is it's taken the power of the AI and the learning, and really put it in a human language, right? So that's kind of the thing that it did, because it's a language model at its core, but also interfaces with these other learning models that are based off of information on the internet. In the broad scheme of things, the way I look at it is healthcare, again, is a complex system made up of complex systems. And one of the things that AI does really well is that it takes care of data, it takes inputs of data that aren't as discrete as, say, like a single lab value. It's great at taking those multifactorial, those large data sets that include both discrete values and textual values, et cetera, and kind of filtering it into something of value. And that's why I think that we call it a neural network. It's very similar to how the human brain works, and that's what humans are good at. We take sort of a complex set of data inputs and are able to come up with something of value on the other end of it, a decision or an action or something like that. In healthcare, I think that because there's so much complexity, AI is going to be extremely helpful, and it already has in a lot of ways. The way I see it playing out is I see AI and providers and operators working really in tandem with one another. And again, like done rightly, it's going to be finding the right tools for the right job, keeping providers at the front and center where they can continue to increase patient trust and build patient trust, and do the things that the human brain does better, while also at the same time freeing them up to not have to worry about the discrete values. So if you think about what has happened, the reason that providers and operators and everyone who's in the EHR, who's operating the clinic, the reason that they are kind of become these data entry specialists is because ultimately what we're trying to do is we're trying to report on discrete values. Like your note has to have these
Yeah.
certain lab values. They have to have certain things that are all in support of this diagnosis, which ultimately is in support of the billing level, right? So I think that if we can take away the over what would be the word, like the crutch that discrete data values have become, the more we can kind of unlock those things. So a really good example would be, back in the day, a provider would either write out a note or dictate a note or something like that. Someone with clinical context or themselves later would go and review that, and there's this synthesis process that happens, right? That then allows them to come up with the proper diagnoses, the proper treatment plan, et cetera. And then that goes into a historical record for future use, and it also goes in support for the bill. Well, we've taken that power of using that narratival data away because we're reliant on discrete data points like
Yeah.
lab values and
Check
something that you
boxes,
key in,
numbers, yeah.
checkboxes. Exactly. So what AI I think is gonna, one of the small but really powerful things that it's going to do is it's going to allow us to rely back on narratival data, which I think is extremely important.
Yeah. No, that's awesome. I like that a lot. I guess you kind of mentioned it, putting the clinician at the center of it. I think I've had conversations with people this week, and most of the people that when I bring up Chat GPT or AI or something like that, they're like, oh, it's going to replace us all and we're all going to be out of a job. And I hear you saying in a different tune, right?
Yes, you do. I have the same I'm in the same boat to some degree because I'm a software developer, and like I've been using there's a tool called GitHub Copilot. I've been using that for about a year now, and it writes code. It writes good code. It also writes really bad code. It's almost like uh it's kind of unpredictable at the moment, but I think with ChatGPT, I think that newer versions are going to be using GPT-4, the newest version of that particular language model. And I think that ultimately, what most of us in our industry and the software development side have leaned on is that it is a great tool for use, but ultimately my job is to be there as an engineer, not so much as the output of code.
Yeah.
So I'm there to solve problems from a higher level in a way that the human brain kind of understands the systems and the complexities that is really, really hard to model in insofar as an AI or machine learning model can model it. And so the best use of this tool is as a co-pilot, as a pair programmer, as someone who's alongside me, helping unlock and creating efficiencies in my workflow, but not necessarily replacing me. I think that something very similar is the case, and probably even to a better degree with providers, because what you have inherently, like it's just me in a screen, right? So that's my work is pretty much that. With a provider, your work is with a patient. It's the whole point is to be caring for and treating a patient, and ultimately, I think there's a whole set of philosophical questions about like can AI be conscious and will
Yeah.
those consciousness replace? Okay, so like barring that conversation, I have a philosophy
Exactly.
degree, so I'm totally happy to go down that route. But barring that conversation, for the sake of the audience, I think one of the things that is really important to remember is that human beings are social animals. And if the pandemic taught us one thing, it's that we can't go without social interaction, in-person social
Exactly.
interaction for very long. And I think especially whenever you look back at kind of what we've touched on in this conversation about clinical outcomes, patient self-advocacy, patient trust, those happen within relationships. And it may sound cliche to say, but I think ultimately at the end of the day, a lot of the reason that a lot of business and especially a lot of healthcare happen the way that they do in this in-person way is because that's just kind of how our societies run. And I think it's all based in just human nature. That's who we are as humans. And I think that ultimately, if you were to ever attempt to replace a provider with an AI completely, that you would see a drop in patient outcomes. That's my hypothesis. I don't know how strongly I hold to it, but I think given the kind of like framework that we're working with here that I've kind of discussed in this conversation, I just don't. That's kind of what I'm betting on, I guess, and I see that it being really a boon as a tool and something that's really going to allow us to live a little bit more of a human life, if you think about it, than
Yeah.
what maybe we've been in healthcare recently.
Well, and maybe even make us more effective, right? Like just take, AI combing the literature, for example, like clinical decision making tools. The reality is that like I can see a patient in the clinic and I could spend 3 4 hours combing the literature for this specific patient situation, what they've got going on and what the literature might say about the best way to treat them. AI can do it in like a minute and a half. And then that means that I'm
Yep.
not doing that for 3 hours and I'm spending more time with the patients.
Yeah, this process that you're kind of touching on, I think, is this idea of synthesis. I do
Yeah.
this a lot in my job where I have to go and look at existing code or existing tech designs and like synthesize what's going on in order to form a better opinion and a better vision of what we should go after. That happens a lot in a variety of different professions and in healthcare. I think you know if imagine that you as a provider had one or two patients, you could, if that were economically feasible, you could set and just literally set and think about the treatment plan. You could think about the diagnoses. You could take the most complex cases and move the needle forward like a little bit in all likelihood, because you have this attention span that's limited and time that's limited, that and then you could be implementing the most cutting edge research. You could possibly even do research yourself in a way and contribute to that science. But the problem is that that's really just not efficient. But to the degree that that synthesis of scientific research and data that your patient is telling you and data that your patient's families are telling you and all that information in order to get the right true picture of what's going on and then therefore be able to create a treatment plan for that, I think that would hopefully, like you said, make that just more efficient. And again, making, if you kind of want to tie it back to business, making every slot that you're taking up in your day, as far as in clinic, super high value and super impactful.
Yeah, yeah, exactly. You're doing from a like a reimbursement perspective, the highest reimbursed services in healthcare are your consultation, those appointments where you're kind of diagnosing or setting the treatment plan. All the other stuff, the follow-up visits, I'm from the physiotherapy, the PT world, like all those follow-up
Mhm.
sessions are not reimbursed at the right level, or not the right level, but at the same level, because the insurance company doesn't see those as valuable. The valuable piece is we got your clinical expertise to evaluate the patient, to determine what was going on, and then to set the treatment plan, right? So if you can book
That's right.
more of those in a given day, that's good for the patients, increases access, and then is good for the business as well, right?
Yeah, that's right. And if you think about it, it doesn't make a whole lot of sense to do it the other way around if you can avoid it. I mean, again, the right tool for the right job. If it's just a simple question, let's make that async. If it's
Yeah.
something that can be evaluated, telehealth, like let's introduce telehealth into our day if we can, or find, people within our clinic who, and I think, I don't know what your position is on this, but I think also just like there are certain areas which are kind of barred to certain providers that like physicians only, that could be in the hands of mid-levels or even
Yeah.
RNs or therapists or whatever. And I just think like sometimes like that's a really tricky kind of bar to like. I understand
Yeah.
the challenge that legislators have in order to like find that the right bar for that. But the point is that like what are the things that we can make just more accessible? And that means taking this sort of bottleneck off of the provider, and also opening up that bottleneck by making them more efficient.
Yeah. No, I totally agree. I mean, that is a podcast topic in and of itself, the way that
Sure, I bet.
regulation and all that kind of impacts care. But yeah, I agree. Like as much as we can do to open up access and give people the tools to access the help they need, or the health care that they need in the time they need it, with the provider they need, the right. We always say like the right treatment for the right person at the right time, right? Right.
That's right. That's great. Yeah, that's great.
So, well, we're nearing the end here, so I always ask this one. So, if you could just leave the listener with one or two main points about implementing technology or tools in their clinical workflows, what would they be?
The tools themselves, like which tools?
Well, not even which tools, but like just high level. Like if you're thinking
Hmm.
about doing this, implementing more technology, what are some of the big things that you would want to keep in mind as somebody that's seen it done well
Yeah,
and someone that's seen it done not so well?
sure. Yeah, yeah. I think I would really lean into this principle that a software solution, a technological solution, is not going to survive the process that it's built on. And I think that it's okay to say like, hey, how do we create better processes within the operations, and how do we understand them? I think part of it is, if you were in a small business, let's say, especially something like manufacturing, where there's a lot of repeatable processes, you tend to think about this first order, right? But if you are in something like healthcare, where everything feels like it's hands-on, just because of the nature of the complexity of healthcare, I think that it's easy to overlook and not think about these things where, okay, like let's isolate the complexity here. One client that I had, whenever I was just doing basic software consulting on my own before getting kind of back in the healthcare world, one of the things that we did when we were talking about their processes is, I said, it sounds like you're having these face-to-face conversations and implementing that process all along the journey that the patient has, when reality is that we can isolate it to just this one instance where they sat down for a 15-minute conversation. And it's kind of like this case management function. Case managers, they do that where they're taking in not just the clinical data points, but also, the social determinants,
Yeah.
like the full picture, and then help coordinate based on that. So I would say, think about it as there's complexities everywhere, but what if I could create my processes where the complexity is really limited to that face-to-face interaction, because that's where the important stuff is going to happen anyways, and you can hash through it there. And that would help you go be on the way to create a consistent and repeatable process for your patients so that they're not surprised. The other thing I would say is if you're not engaging your patients digitally somehow, some way, consistently, then you got to start doing that. You got to find a way to make that happen in a way that feels right for you and your clinic. I mean, I think that right now we're in a very mixed population where there are patients who prefer to be engaged digitally, and there are patients who prefer to engage in person and really reject. And there's a whole variation in
Yeah.
between that spectrum, right? One of the best things that I heard was from an operator for a really successful rural healthcare system. And one of the things that she said is you have to have a strategy for each of those patient personas. One of the things that we do in marketing, right, is we say like, what are the different personas of people that I'm targeting, and try to like identify like who those people are. Apologies, no man. Um, So I'm going to talk over them. I'm going to try to talk over them to wrap up. So I think that one of the things that you have to do is, like I said, have a strategy for if you have this patient that is like, you know, not having it with the digital stuff, have a solution that is still kind of repeatable and helpful to them and to continue to engage their trust. Don't treat patients as if they can be, like lost to attrition. And then as far as the rest of the patient population, that the digitally engaged population is only going to grow. So time is on your side as you
Yeah.
adopt those strategies.
Just got to wait long
So
enough, right?
that's right. Yeah, that's right. And I would say too, like finding the right vendors and people you trust to consult about these things. Like, we can't unfortunately consult with every single one of our clients just because we're doing the building as well. But there are people out there who are worth trusting. They can talk about, HIPAA and security, which vendors are right for them, and those sorts of things. It obviously isn't just another cost amongst many other costs that you have to worry about. But I think that it can be an investment, especially if you're a growing clinic.
Yeah. Awesome. Well, Devin, thanks so much for taking the time. If people want to find out more about you, about your work, where can they do that?
Yes, connect with me on LinkedIn. My name is Devin Mobley, DEVON MOBLEY. Our website is calvient.com. I'm sure that'll be linked somewhere where they can
Oh,
see
yeah.
that. And yeah, I'd be happy to meet and just talk healthcare like this, or get to know you, hear your problems as an operator or as a clinician, and or otherwise, if you're interested in our products, then we'd be happy to talk about those as well. So
Awesome. Cool deal. Well, thanks so much. Have a good one.
awesome. Thank you so much.
Well, I hope you enjoyed that conversation with Devin Mobley from Calvient Health. We'll leave all the links to his LinkedIn profile, to their website in the show notes. You can head on over to betteroutcomes.show. Click the link over to the website, the podcast website for that. Or you can head on over to rehabupracticesolutions.com, click on the drop down for podcast, find this show, which is 087, and they'll be there in the show notes. One of the things, going back and listening to this conversation again, that I think is worth noting, one, I think it is because Devin is not a clinician himself. He's an engineer. He's used to building these workflows and creating the system and the process. I think as clinicians, we just come at it from a different angle, so it's nice to get his perspective. But he said that the tool itself will not survive the process that it's built upon. I think a lot of times, at least for clinicians, and clinicians turn managers or clinic owners or something of the like, there's a lot of emphasis placed on the specific process and the workflows. And one of my clinicians at the clinic that I own and run makes fun of me all the time for talking and using the word iterative a lot. I say, yeah, it's going to be an iterative process while we implement this new technology, while we do whatever, right? Whatever it is that we're going to do, whether it be rolling out a new automation or a new tool or a new way of delivering services, or even just a new process of like onboarding and scheduling patients. It's got to be an iterative process. There's going to be, because each clinic is different and each clinical pathway or patient life cycle is different. There's going to be some things that are very similar and that are plug and play, and then some things that are going to take a little bit of not customization where you're building the entire tool from scratch, but a little bit of customization of the workflow itself. And I've seen this a good bit doing work with healthcare technology companies that are launching into the US market, primarily in the physiotherapy or physical therapy space. They're realizing that a lot of what they have to do, their tool is great a lot of times, most of the times. All the ones I work with, their tools are wonderful. But the tools are great. They function well. They do what they're supposed to do. They make the clinician's life easier. They would make the clinician's life easier. The challenge that they run into is that clinicians don't adopt it for whatever reason. And the main reason when we're looking at it revolves around the process. Like, how does this tool fit into what I normally do, the process of my delivering care? If it's a home exercise program platform, for example, I'm used to doing X, Y, Z, and this tool is A, and now I need to log into another screen, or I need to do whatever. So from the healthcare tech side, from the service provider side, a lot of it is, how do we take this tool after you've agreed to implement it in your practice? How do we take it and build in the workflow with you so that it is a seamless integration for the clinicians or the end users that are going to be actually in the system every day or on the platform every day? If it's one of those things where it becomes too much of a headache, or there isn't a lot of guidance, then it fails to get utilized and it gets cut, right? So I've been advising a lot of my clients in this space that are tech companies that are trying to help make the lives of clinicians easier. A lot of what you're going to end up needing to do afterwards, after you make the sale, is not just give them the tool and walk away, but there needs to be a very big customer success, for lack of a better word, or consultative integration after the fact, so that the tool itself gets used, so the clinicians see the benefit and the ease that it brings to their life, and then also the patients reap the benefit as well, and then being able to obviously bring around some sort of ROI, either in the sense of patient engagement, as Devin said, and retention throughout the course of care, decreased utilization rates and all of that, or increased revenue on the billing side in the area of remote therapeutic monitoring or something like that. So just a few thoughts on that. I love the idea that the process is going to change. It's going to be an iterative process as you begin implementing these things in your practice or in a clinical workflow. So that's all I've got this week. If you like the show, head on over to iTunes, leave us a rating and review. Helps people find us. If you want to be updated or stay up to date with all of the shows and episodes and links to guests' profiles and websites and all that, you can sign up at www.betteroutcomes.show. Fill in the form there, and we'll send you an email whenever we drop an episode. Usually it's every other week. Recently we've been on an every week kick just because we've had a ton of interviews, and this is hopefully the first in a series of conversations that we're going to share on the podcast around technology and technological tools in both the service delivery side, so actually delivering remote therapeutic monitoring, for example, or virtual service delivery like asynchronous telehealth or synchronous telehealth, but then also on the administrative side, so the AI for billing, for example, or using technology to automate patient engagement or something of that nature. So I thought this was a good conversation, this conversation with Devin, because we kind of had this high-level discussion or kind of set the groundwork for, okay, if you're going to implement technology, these are some of the things that you want to think about as you roll it out across your clinical workflows and clinical processes. And now the next few that we'll release will be more nitty gritty, so to speak, or specific areas. So service delivery, remote therapeutic monitoring, technology for administrative workflows and patient engagement and all of that. So that's what we've got going on here at the podcast. And if you run a healthcare organization and you want to implement virtual service delivery and you want some help doing that, I do that as well with what we call the telehealth roadmap. you can head on over to rehabilipracticesolutions.com, click on what we do, and then the link for Telehealth Roadmap. You can read all about it. If you're a healthcare technology company or platform, tool, or device, and you're looking at making a go at making clinicians' lives easier, either helping them develop or deliver virtual services, and you want some help with go-to-market strategy, check out the market penetration roadmap. You can find that at strategy.rehabilipracticesolutions.com. Basically, what we do is we help you refine your positioning. We do some market research and insight gathering and generation for you. We use that to align your product or your tool with your selected healthcare stakeholder or target market. And then we develop a specific market penetration strategy that involves business development enablement, providing the tools, resources that you would need or your salespeople will need to get your product into the hands of clinicians who will use it. So again, if you like the way that sounds, head on over to strategy.rehabilipracticesolutions.com. All right, until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabilipracticesolutions.com. We'll catch you on the next episode.